you would have to, right?
$6320 Coach Flight Lane.
Yeah, Valerie Stoltz is in District 3, yes,
Right.
yes.
34116, that's...
Okay, let's move on then to
Okay.
Lieutenant Watt on Safe Haven Project. Lieutenant Watt.
Good afternoon. Thank you for having me today. In the year 2000, the Florida legislature produced a statute that would allow for mothers of newborn babies to be able to give them voluntarily if they decided they couldn't care for them or were unable to keep them without persecution of criminal charges, as long as they were unharmed within 3 days of their birth, to a fire station, a hospital, and then in the year 2001 they expanded that to any EMS station. The only problem is apparently the public has not been very well informed. We're still finding cases throughout the state of Florida where these babies are still being killed and abandoned and left for dead. We had, a case in Immokalee in our county as well in the last year or so. But we've been able to work with a foundation out of Miami who is also as concerned about these innocent children as we are, to be able to prevent some of these mothers that are unaware of this statute, this protection that they have, to have the facilities available to them, to know what numbers to call. They have provided us with material. They're a not-for-profit organization. They provided us with materials that we're going to be handing out around the county to educate the public. I've given you a sample of one in English. They're very colorful. They were done by artists and a lot of people who volunteered many hours towards this project. They also man a 24-hour hotline for the mothers to call. Anywhere in the state of Florida, they may call at any time of the day to ask questions. If they need counseling, they're not sure they want to do it, they can, pass them on with people that are there in social services that will be able to help them to make the right decision. They also have a list of all the county organizations throughout the state of Florida. Perhaps they don't want to have, the child left in their county. Somebody might recognize them. So if they want to go to Orlando, they can call this number and say, where can I drop my baby off in Orlando? So if they feel safer, just so that the child has this chance to survive. The stipulations for the law, or the statute, does require that the child be unharmed. There can be no negligence or abuse, and they must be within that 3-day time period. And they will be turned over without any questions asked. If the parent would like to answer medical history on their family, that's fine. Otherwise, there's no names taken. And the way that we've set it up in our county is that the dispatcher will be contacted after the contact is made with the parent and they want to bring a child to somewhere in our county. 911 will be contacted through control. Then either the closest fire unit, EMS, or police officer, or if they want to go to the hospital, they still have that availability of going directly to the hospital, will be dispatched to meet with that parent so that the child can be taken for medical exam at the closest facility to ensure that the child is not suffering from dehydration or malnutrition or something else, that it has been cared during these few hours or this period of time, that everything has been done properly if it's a newborn baby. And then from that point, social services is contacted. The parent also has the right to reclaim the child within a certain time period while it's in the court deciding jurisdiction on where the child's going to go through social services. So it gives them a cooling off period. It's not like the decision has been made, but it gives that child the chance where no harm can come to it. It has protection of being in good and safe hands. We're doing public service announcements. We're trying to get on the television stations, and as I said, we're having our units go to different areas, community centers. We want to hit some of the educational facilities and any of the local places where teens and parents and will be, that they can get this type of material and have access to it. We also have a couple of different types of posters that we're trying to put around so that they at least will have the information to know that there is another option, and that hopefully we can bring a reduction to some of these sad cases that end up where the child just doesn't have a chance, and hopefully we'll be able end up in a loving and caring home.
Lieutenant Watt, how long has this been, how old is this organization?
This has just been formulated in the last few
Oh.
months.
Oh,
so we've
okay,
met-
brand new.
Mm-hmm.
Okay.
Yes, this gentleman has a foundation in his wife's name who had passed away and did many things for children and parents. And
You know the name of the foundation by?
Yes, it's the Gloria Silverio Foundation.
Can you spell that for us?
Yes, it actually should be right on.
Is it on here?
Should be on the back, but if not, I can get that for you. Yeah, it's Silverio.
Again, S-I-L.
Silverio. First name Gloria,
Yes.
and they're out of Miami, and they can be reached at this 800 number, and you can just ask for Nick. He's the gentleman that is the administrator for the organization.
Yeah, also, the Community Foundation of Collier County should know about this also.
Yes.
They might be willing also to get some grants or whatever.
Oh, that'd be great. Yeah, like I said, and we have it in Creole, we have it in Spanish and English. So that way we have the availability of everyone having access. And we've
It's a
got
wonderful
a big
thing.
promotion going, you know, in many areas of the county at this time. We're working on it. So
Neighbor care.
hopefully
Question?
we'll get a lot of good news out of this.
Yes.
And we're meeting with the fire chiefs. We had to postpone a meeting that we had last week. A lot of people were at the hurricane management meeting, so we're going to present it again at the next meeting.
Any
So-
comments, questions? for
We'll have
Lieutenant
the
Watt?
liaison with the fire department and the hospital.
I don't have one.
Okay.
I don't have any.
Oh, you have some extra?
Oh, absolutely.
Any other comments or questions about this?
Well,
She's doing a very fine job.
Yeah, that's great.
You know, it just occurred to me, it was neighbor care, look,
Youth Haven?
Claudia, the husband and wife, Lacadia, you know what I'm
Oh, you're talking about the neighborhood
neighborhood
clinic.
clinic.
Yeah.
Neighborhood clinic.
Yeah.
It would seem to me,
You're talking
Lashai,
Lashai,
thank you,
yeah.
Nancy and Bob.
Yeah.
It would seem to me that any of those facilities that are dealing with the indigent may be primary targets.
And all the hospitals know about this also.
Right, right. They're going to be the drop-off point.
Very good.
Eventually, if they don't come from us, then they will come either directly to the hospitals. And then we still want to be notified that they've gone through the 800 number or the, it's not actually the 800, but it's a toll-free number, 877-767-DA.
Now, how about the high schools and talking,
We
you
have
know,
to go through the school boards for that.
The-
but
for
we're
the school
trying-
board.
The colleges, you know.
yeah,
that's
we have a lot of
what we're
pregnant girls in
targeting.
school.
Good idea, yeah.
Can we get these and put them up at like mobile stations and, because I
Right.
live in District 5, that's why I represent where, you know, Mockley and
Right,
a lot of the,
we've got the whole county.
where you can put, they have bulletin boards where they sell their little, they have, you can put those,
Any other ideas?
Yeah.
Powerful, they get your attention.
yeah.
The little hand.
Sandy, did you mention the bulletin board? I mean, not the bulletin board, the actual advertising that they're, billboard.
The billboard, no. There is going to be a billboard for our county, but you know how few billboards were allowed in the county, so they haven't given us a location yet. They're hoping to get that within the month. We're still working with the television stations to try to get this public service commercial that we have already viewed and approved.
And Project Help and all the abused for women, all that stuff.
Right. So we just wanted you all to be aware of what we're working on.
Just wanted to ask another question. What arrangements have you made with what agencies then, beyond the care of the child, the immediate?
That social services comes in from the hospital, and they continue on. And like I said, if the parent wants to contact, they have to go through the judicial system. If they should change their mind, or if their situation should change, and a month or so down the road, they find that they are able to take care of their child, or the emotional shock or the acceptance by their family, you know, has been, you know, overcome. Because sometimes it's just a reaction. They deny their pregnancy, you know, if they're the young parents, and either they're hiding it and they just don't think they'll be accepted, so they end up, I've got to do something, I got to do it now. But this lets them know way before, when they're thinking, you know, what am I going to do, what am I going to do? They have someone they can talk to, there's counselors that they can be referred to from this number, and help them to make the right decision. If they want ministers, they, you know, have access to clergy member, so they can make an educated choice.
Great
Just a
program.
rash decision.
They can remain
Great program,
anonymous.
yeah.
Great.
Very
We hope it's going to be wonderful, and we have no more.
Thank you for coming and
Yes,
sharing it with
thank
us.
you.
Yes, very much. That's great. Okay. Operations report, Jeff?
I have just a few things. One of them is our July meeting we need to change the date.
Yes.
The dates that we have available,
Now, everybody got one of these, you know, the dates for the summer and so forth, so if you look at the July one, yeah. July 30th?
July
Which is what
30th.
day? Is
It's a Tuesday.
Tuesday? Is everything clear for this room for Tuesday then?
Correct, Barb?
Everything's
We're all
clear
set
for
for the
that?
room that day?
No, the 30th is the day we cannot have it.
Oh.
No,
We
31st. Changed to
Change.
July 30th?
And we can't have it the 31st either.
Okay.
Either
We
one.
have to take either the 23rd, 24th, or 26th.
The 23rd is the Tuesday, the 24th is Wednesday, the 26th is Friday.
How about the 24th, keeping it on Wednesday?
I would certainly agree with that.
Is that all right, instead of a
That's
different day? Oh, well, that's all right, just call in your excuse. Is the 24th all right with everybody?
The Fire Chiefs Conference is that week, and it's being hosted by the City of Naples and by Collier County, and I am a speaker. I believe it is the 24th.
On the 24th.
Chief McAvoy, I believe, is committed also.
I'm the host. I'm well committed to that.
Jim, on the 24th?
Yes.
Yeah, it
Okay.
is
What were
that
the other
week.
dates?
The 23rd and 26th. The 23rd would be a Tuesday, the 26th is a Friday.
A Friday.
Friday works well for me.
Yeah,
Friday is the-
26th is okay.
All right with everybody? 26th? That's a Friday. I can't do it on a Tuesday, I know. 26th? All right.
Code enforcement
All
hearing.
right, then it's changed to the 26th at 2 o'clock. Is the room available?
Yes, those
It
were
is.
the 3 dates they had
That's right.
available.
Okay. All right, that's taken care of. Okey-doke.
Okay, I believe Barb passed out actually the letters from the state on the grants. And Diana, did you want to speak to that, or?
Yeah. Is somebody going to speak?
Because I think there was a third letter that actually came in also.
Do you want to come, somebody come up and talk to that?
Good afternoon.
Good afternoon.
The state has just sent the commissioners the information on the grants in a specific award letter. As you can see in the MDT grant, the state will be sending Collier County a check for $59,625. The MDT grant is the mobile data terminals.
Wait, that's 75% of the total cost, is that correct? Yeah, okay.
Correct.
Uh-huh.
And then the second one is the state will be sending